All right, well, we want to respect everyone's time, so going to go ahead and get started. My name is Alexis Whittem. I'm the Director of Communications for the Colorado Coalition for the Homeless. We really appreciate you joining us for the second session of our 2022 Colorado Coalition for the Homeless's Education Series. It's designed for advocates, community members in need, and anyone who wants to listen, learn, ask questions, and engage with important information on combating homelessness. These generally happen the third Thursday of most months throughout 2022. So if you missed our last session on women and homelessness or want to see some sessions from last year, you can always find them on YouTube. We put them up the day after. Ryan, will you go to the next slide? Thank you. So today we're really excited. We're going to deep dive into the world of public benefits. It's a very complex issue. Sorry, Ryan, slide before, I was off. It's a complex issue and it's a lot to take in. And we know that folks who attend these sessions, some people have no experience working within these systems. Some people work with clients, some people work on policy. And so we want to make sure we hit all those notes and cover a lot of information here today. So we have three really wonderful speakers and then a lot of time left at the end for Q&A. We're going to cover how to access benefits, barriers to economic security, and opportunities to increase economic support for people experiencing homelessness or living in poverty. Our experts will present on key assistance programs such as Colorado Works, also known as Tanf, the Temporary Assistance for Needy Families, Aid to the Needy and Disabled Program, Medicaid, and more. So we're going to go over a few things about the session before we start, our little housekeeping. First of all, for our agenda, as I said, we'll just have three speakers. They'll each be about 10 to 15 minutes each. They are sort of a presentation style. So if you have questions, unless it's really confusing or you need to clarify, please plan on holding your questions. You can put them in the Q&A box for later, but we likely won't be interrupting our speakers. So just want to let you know, we're going to let folks sort of go through and then at the end, we'll have a ton of time to talk about it. And as we progress in this, we'll sort of go from big picture to smaller and smaller so that you can get a lot of different types of information. The presentation is in the Zoom webinar format, which means that only the panelists are able to unmute and have their videos on. So if you do have questions, please do use the Q&A feature. The staff will be monitoring that, and then we'll be able to ask questions towards the end. You can always use the chat if you have questions for us. If you want to talk to other participants, we often know each other in here, so connect via chat. We were supposed to have a captioner here today. We haven't seen her yet. So unfortunately, I don't know that we're going to have this live captioned, but when we put it on YouTube tomorrow, we will be able to enable the captioning feature that's built into YouTube that automatically captions. So I hope that if anyone needs that service, they're able to access it tomorrow. I sincerely apologize. And we have Amy. Okay, great. So I'm going to give Ryan just a minute to assign the captioning to Amy, just to make sure that we do have that accessibility built in. Thank you, Amy. And so if you would like to see the captions as we go, you should have a little CC button at the bottom, and you should be able to view captions. It might take about a minute for that to show up, but that's a feature that we have and we want folks to be able to access. So always the fun of Zoom, even 2 years later, it looks like we had the wrong link to Amy, so getting it all sorted now. Okay, and then I just want to talk about, if you want to share during the event, after the event, we have our hashtag there. We can also put it in the chat, and you have all of our handles. So you can reach out to the organizations that are speaking today and be sure to tag us if you're on Twitter or Facebook, all of those good things. So Ryan, are you good on the captioning? We can move on to the next slide.
I've assigned Amy as the captioner, and so I believe that she has permissions. Is that correct, Amy?
Yes, I apologize. I will be up in about 30 seconds.
Perfect,
okay.
Thanks.
Awesome. We're just going to hold for that so that we're fully accessible, and I appreciate everyone's patience as we get that going.
Okay, we're good to go. Have a great event.
Perfect.
Awesome.
Thank you.
Thank you, Amy. All right, so I want to introduce our first presenter today, Liz Riley Sanders. Liz serves as a policy advocate at Colorado Center on Law and Policy, where she works to align organizational and partner efforts to create a responsive through line from community needs to policy solutions. With a Master's of Health Administration and JD with a concentration in health law from St. Louis University, her expertise lies in elevating community voices to advocate for positive, sustainable change, speaking truth to power, and coordinating the efforts of diverse stakeholders to propose and pursue solutions that prioritize those who are most negatively impacted by public policies. She works at the Colorado Center on Law and Policy, and their mission is to stand with diverse communities across Colorado in the fight against poverty, against research, legislation, and legal advocacy. So I'll go ahead and pass it to you, Liz.
Awesome. Thank you so much, Alexis. That was a great bio. I wonder who wrote that. I appreciate it. Welcome everyone. I'm really excited to be able to spend the evening with you. I am going to be presenting on some really super high level concepts around public benefits. And I believe that somebody has my PowerPoint, I hope. Okay. Perfect. Wonderful. Okay. As I said, I'm going to be presenting on public benefits just very generally. It's super high level, and I didn't get a chance to do all of the public benefits that are available in Colorado, but some of the more popular and more important ones for sure. And then we can have a discussion at the end of the presentations. If you could go to the next slide, please. So topics that I'd love to discuss with you all today are really around the nutrition-related benefits, health-related benefits, and income-related benefits. I'm going to do a super high-level overview of those particular programs, and then dig a little bit into some of the trends and issues that we've seen at CCLP, some of the things that we're monitoring, and then some future expectations that we are seeing on the horizon. And then I will definitely pass it on to some of our other presenters who will probably get a little bit more deeper into the programs that I'm discussing. Next slide, please. So first, nutrition-related benefits. These are going to be all related to food assistance. If you could please go to the next slide. First, we have the SNAP program, and I'm going to do my best not to read these slides to you. There's a ton of information here. I'm just going to do a brief overview, and then Alexis and other of her colleagues will have access to this PowerPoint presentation if anybody needs to access that moving forward. So SNAP stands for the Supplemental Nutrition Assistance Program, and basically they exist to help low-income families and individuals purchase food. They're very much focused on creating avenues towards healthy eating and food security. This benefit is mostly based on, it's provided on an income basis, meaning that individuals have certain income limits and bank balance limits that they must meet to remain eligible. Some of the other ways that the SNAP program really incentivizes healthy eating is through benefits such as the Double Up Food Bucks program, which is literally getting more bang for your buck when you are purchasing healthy foods in eligible stores. So for example, you can purchase more fresh fruits and vegetables for the same amount of money that might cost to buy a bag of chips, let's say. The SNAP program is actually administered by individual counties, and they load funds onto something similar to a debit card, which is called an EBT card, and individuals can use that card to purchase food in the stores. So for example, as far as what the benefit looks like, we're looking at something close to $500 a month for a family of 3, depending on that family's income. Next slide, please. This slide really just shows enrollment rates over the past couple of years, and you can see that those enrollment rates really spiked with the pandemic. And I'm not going to get too far into this because I have a couple of trends a little bit later in the presentation, and I know that we have some partners here who can really dig into more details around the SNAP program. But it's really important. SNAP is there's a lot of assistance programs out there, some of whom are on this call tonight, and there's a lot of opportunities to get some help if you're looking to apply or to recertify, because it can get kind of complicated. The next nutrition-related benefit program is Special Supplemental Nutrition Program for Women, Infants, and Children. This is also known as the WIC program. Very much interested, once again, in helping individuals and families lead healthier lifestyles. This program is really open to individuals, specifically those who are either pregnant or who have recently had babies. They're very much available to assist individuals who are breast or chest feeding, or who may be new mothers, or who have children under the age of 5. Eligibility really is, once again, it's income-based, and you can find quite a bit of information about eligibility online. And there's a bunch of other services that this program provides, as far as cooking instruction, connection to other services, and then breastfeeding support. An average benefit, thank you. An average benefit per month is around $40. Okay, next slide, please. Some other programs that are really food related, I'm just gonna do super high level here, is obviously the SNAP program, but the PEBT program, which is really focused on providing food to students when either they were in remote learning or over the summer. That's a program that was started during the pandemic. There's also the SNAP ED program. This is an incredible program that provides services to individuals who are looking to really take their healthier lifestyle to a new level. There's some cooking classes that are available there. It helps motivate individuals to be more physically active, and then really kind of trains families in ways that they can live healthier lifestyles that are culturally relevant and specific to their particular communities. And then finally, there's a bunch of food distribution programs that the Colorado Department of Human Services runs. And these are mostly aligned with outside organizations, but individuals can become involved as well. There's going to be a resource slide at the end of this presentation that has a bunch of links if anybody's interested to learn more about these programs. Next, health-related benefits. When we talk about health-related benefits, we're really talking about access to care, and ensuring that individuals can, in fact, go see a doctor when and how they need to. So the first program, next slide, please, is Health First Colorado. That's Colorado's Medicaid program. It's basically a free or low-cost healthcare program for Colorado children and individuals adults who qualify. There are, once again, specific monthly income requirements, and individuals are basically given insurance to see primary care providers, in some cases, some dental care providers, and then behavioral health services. Here is because it is an income-based program, there are, of course, income limits. And oftentimes individuals are asked to contribute a copay to their care episode, but there's generally no premiums for this particular program. Next slide really just shows, once again, Medicaid enrollment over the past several years. We can see that it has increased steadily since the beginning of the pandemic. It's something that we are keeping a close eye on, and I have some specific trends towards the end of this presentation about what Medicaid enrollment may look like moving forward. So other services that Medicaid provides beyond the kind of general buckets of physical care, dental care, and behavioral health services, you can see that there's access to pharmacies and different medical equipments. There's occupational, physical, and speech therapy. Some family planning services are available, as well as preventative and wellness services. These are available for most people who qualify for the Health First Colorado program. And the preventative services are those that you're going to go see a primary care provider, and it's something that is heavily encouraged in this particular program. The Child Health Plan Plus is also known as CHIP, and this is really just low cost public insurance for children and pregnant women. This program is available for individuals who may not qualify for the Health First Colorado or Medicaid program. CHIP covers primary care, emergency care services, dental care, various prescriptions and immunizations, as well as maternity care and behavioral health care. Once again, this is an income-based program, and it is available to those who generally make around 250% of the federal poverty level. I have some charts later on in the presentation that kind of put the dollar amount on that number. As far as CSP Plus goes, there are some enrollment fees that can sometimes be charged annually, and then there are copays, but generally, once again, there are no premiums. Next slide, please. Thank you. CHP Plus enrollment actually went down during the pandemic. I know that I'm flying through these slides, but I just wanted to give a visual of what enrollment generally looks like for some of these more popular programs. We've looked at these numbers, and we don't have any specific reasons, but we are finding that the vast majority we are assuming that many people who are dropping off of CHP Plus are now qualified for Medicaid. But this is something that we're going to be continuing to watch closely as the public health emergency ends. I see in the chat that somebody asked if CHIP is available to families who are undocumented. I can check that. If you all give me a moment, I'll have an answer to that question before the end of the presentation, and I'll answer it in the chat. Thank you. This particular subsidized insurance program is something that's new. It will actually be coming out in 2023, specifically for undocumented individuals, DACA recipients, and others who aren't able to show citizen status. And that's something that would be offered through the Colorado Health Exchange. And there's not a ton of information out there right now, but we're keeping an eye on this, and information will be coming shortly, very soon, by 2023. Okay, great. Income-related benefits. This is kind of generally what we think about, or what we mean when we talk about cash assistance or employment retention and support. Next slide, please. The first is the Colorado Works program, also known as Tanf. This program is really focused on helping individuals and families becoming more self-sufficient and strengthening their economic and social stability. Colorado Works is once again administered by the various counties and is an income-based program. So this particular program really is a financial safety net in that individuals are granted a set amount of money depending on income every single month. There are some enrollment limits up to 60 months. People can be a part of the TANF program. And then there are some work requirements. But one of the beautiful things about the Colorado Works program is that it really does connect individuals and families to various services that help individuals either find, locate, and secure a job, or various support services that can be used to retain a job. One thing that I did learn over the past couple of weeks is that individuals who are part of the Colorado Works program and who are receiving SNAP can directly access their funds on their EBT card. So there's not more than one card that helps connect these programs. Next slide, please. This slide is showing once again enrollment rates. And one of the things that we at CCLP noticed is that Tanf enrollment rates actually have been decreasing during the pandemic. Lots of speculation about why that may be, but it is definitely something that we are monitoring very closely. So this is, we have 2 slides for Tanf. I apologize. No wonder there are so many slides. Old age pension is another financial assistance program for older adults specifically, those individuals who are age 60 years old or older. There are some eligibility, income limits, obviously, and it is truly for individuals who are in the later years. This program does not provide a consistent kind of lump sum of financial assistance, but that amount kind of varies as the individual's income may vary, or that minimum acceptable level of income shifts from year to year. Some individuals who do not qualify for Medicaid can receive some health benefits through old age pension or OAP. Sometimes this is referred to like a state medical program, but it's definitely something to look into if an individual is maybe, has hit those income limits for Medicaid, but does still qualify for OAP. Slide, please. Thank you. Supplemental security income. This is SSI. I'm sure that many of you have heard of this particular program. It's just a monthly stipend for individuals who meet particular requirements as far as age, disability, or blindness go. So this is not Social Security the way that some people may tend to think about it. Social Security, as we tend to think about it, is something that is based on wages earned across a lifetime. This is something that's actually means tested. And it's once again that monthly stipend to individuals who have either reached a certain age, have disabilities, or are blind. Dependent children of recipients can also receive SSI benefit payments in particular circumstances. And this particular criteria can actually deem an individual eligible for SSI payments and SSDI payments, which is the next slide, please. That is Social Security disability insurance. So once again, this is different from Social Security, but this particular program is in fact calculated based on an individual's work history. There are particular exceptions if somebody is too young to have, a broad base of work history or limited work history, but it is something that individuals can receive if they meet certain criteria. The eligibility criteria are listed here. And the benefit amount really does vary based on the individual's needs and as I said before, their work history. Aid to the Needy and Disabled, A&D, is an adult financial program that's also administered by the Department of Human Services. It provides supplemental payments for individuals who are receiving supplemental Social Security income, that SSI payments, due to either disability or blindness, and may not qualify for the full SSI benefit. So this is something that there's actually 2 A&D programs. It gets a bit complicated and I'm doing my best to simplify them. But the first A&D program is supplemental and helps individuals who are either not receiving their full SSI payment or are waiting for the application to go through. The second A&D program is once again cash assistance for individuals who are looking for that supplemental aid when when they are unable to work. So this is once again tied to SSI, but individuals who are unable to work at all can be approved for this particular program. It's a much smaller payment every single month, a max about $200 a month, but it's something that is really supplemental and requires application and acceptance into other programs. The last program is the Colorado Child Care Assistance Program, or Ccap. This helps in families specifically who are either homeless, working, searching for work, or are enrolled in the Tanf program. And it's really a way to access childcare assistance. I'm so sorry, please go back to that slide. I was just looking, it doesn't look like, it looks like I have some information in there from the SSI slide. I apologize. The interesting thing about Ccap is that the actual amount is something that is determined by each county. And so it really depends on where the family is located. That will determine what their eligibility requirements are and the actual assistance amount. And so this is a program that is a little bit unique in Colorado in that it's something that changes depending on where the family is located. Thank you. Next slide. We need to talk a little bit about high-level trends at this point, and then we can move into what to expect. Next slide, please. So in the nutrition assistance programs, we found that WIC specifically has been really experiencing declines before the pandemic anyway. In Colorado, we found that only 50% of eligible individuals were actually participating, and this was all the way back in 2018. The numbers continued to decline during the pandemic. And we found that there was between a 1% and 3% drop in enrollment rates during the pandemic. On the other hand, SNAP increased. And what we're hopeful for is that individuals who qualified for WIC were picked up on the SNAP side, although the WIC program does in fact offer different services, more targeted and specific services than SNAP for children and for pregnant or nursing mothers. So SNAP has increased as WIC has declined. On the health benefits side, Medicaid rates have increased during the pandemic. It's up almost 20% or a little over 20%, and about 15% for children. And then TANF has been interesting. So we did see the small bump at the very beginning of the pandemic, and towards the end, it's actually fell to lower levels, lower enrollment rates than even before the pandemic started. So those are the general trends that we've been seeing in public benefits programs across the state. Next slide, please. This is a very interesting chart that I would encourage advocates and support services individuals to take a look at. It really does outline particular benefits programs and where their eligibility limits sit compared to the self-sufficiency standard. What would it take for an individual to be fully self-sufficient in that particular locality? So for example, you can see on the far left in that kind of gold yellow box, you'll see the SNAP program at 130%, whereas self-sufficiency for an individual living in Denver County, all the way on the right side in the green box, is right around 300%. And that would mean a family of 3 would need to earn about $66,000 a year to be fully self-sufficient. And then you can see that at that point, they would not be eligible for any of the programs on this particular graph. Next slide, please. This graph is also incredibly interesting for advocates who are looking at the ways the cliff effect impacts individuals. So the cliff effect is something that individuals and families face as their income increases and they're no longer eligible for public benefits programs. and they start losing public benefit, or excuse me, losing their programs, their benefits. In some cases, you will be earning more money, but you actually are bringing home less money because you're now paying for services that you received through various programs previously. This slide is especially interesting because it does show there at the $22, $23 per hour wage, where multiple benefits are just cut off, and that's an extreme cliff. Yes, thank you. So what's happening next? As advocates, we try to anticipate what individuals might be experiencing moving forward. So we know that SNAP benefits actually increase with the Thrifty Food Plan reevaluation. Is the first time that has happened in decades, which is a very great thing. Those benefits increased about 25%. At the same time, maximum allotment amounts were increased because of the public's the public health emergency, but we are anticipating that ending here soon, most likely this summer. And that means the individuals or families who are on SNAP will no longer be receiving their maximum allotment amount, but it is nicely timed with that increase in the Thrifty Food Plan reevaluation program. So that's something for direct service providers to be aware of and to be able to help individuals navigate through. On the health benefits side, I'm so sorry. Would you please go back? Thank you. We're concerned a little bit about individuals no longer being eligible for Medicaid. At the current moment, they're not evaluating individuals for ineligibility, but that's something that will resume again once the public health emergency ends. I read a Denver Post article that said close to 500,000 individuals may likely be ineligible once that happens. For individuals who help others navigate this public benefits maze, please do keep in mind the CHP Plus and the various subsidized plans through the market exchange. And then finally, there is a bill that's up for consideration right now that would possibly increase Tanf payments. Fingers crossed for that to go through, because that's something that would be very important. It also helps remove the cliff effect and decrease sanctions, among other provisions of that bill. So that's something that we're watching very closely. Next slide is all of those resources that I referred to. Each one of these has a link for individuals to learn more, and I will be around at the end of this presentation to help answer questions. Thank you. My email address is here if anybody needs to get in touch with me after this presentation.
Awesome. Thank you so much, Liz. That was amazing. There was just so much information to take in. I know it can be a lot. So just a reminder that we'll be sending out this whole slideshow and emails for the presenters, so that if you want to follow up on anything, learn more, get a refresher course, you'll be able to do that. And thank you, Liz. There are clickable links on that last resource page. So as you get this presentation, you will really be able to access those right there. So I'm going to introduce our next speaker. We have Ashley Wieland. Ashley is a public health policy attorney and advocate, and serves as the director of public policy at Hunger Free Colorado, where she works to improve public health through policy change at the federal, state, and local levels. Ashley also serves as a board member of Colorado Immigrant Rights Coalition Action Fund and the Women's Lobby of Colorado. I'll let Ashley tell you more about Hunger Colorado and the amazing work they do. So we'll hand it to you, Ashley. And did you want to share your slides, or did you want Ryan to do it?
Oh, I could actually, if Ryan has it, Ryan, go. I thought they were all together. So yeah.
No, yeah, it's all together. So, all right.
Okay.
Great. Thank you.
Great. Well, hi, everybody. That was perfect. Liz went over the details of programs, and I'm going to talk a little bit more about the political side of things and policy side of things at the Capitol, and the ways that Hunger Free works to advocate to make the programs Liz talked about better. And we work really closely with CCLP on that. So thank you to Liz for working with us on that. So Hunger Free Colorado is an advocacy organization that works to help people connect with food. Our mission is to connect people to food resources, to meet existing needs, and to drive policy systems and social change to end hunger. And our vision is that every Coloradan has equitable access to nutritious, culturally relevant food. Our values are equity, agency, and collaboration. So really trying to work to make our organization focus on equity, but do it from a point where folks have agency from communities that may not have food access, and that we're collaborating with community as well as other organizations. I'm going to go ahead. So just a quick thing about our programs and some links in here for folks if you all are helping folks get resources. We also have a client services team, which is awesome. We have probably about 15, I think, navigators who help folks find food resources and enroll in those programs Liz was talking about. So they can call our statewide and toll-free hotline. I think our times are open 8 to 4, or you can also check out our website, which has a lot of resources to just get quickly to get help. And you can also fill out a form, or folks who need help getting nutrition services and programs can fill out that form, and our hotline staff will call them back, which is an easier way to do it as well. We also have staff who go to organizations and table and help folks get enrolled. We go to Adams County pretty regularly. And we also have a lot of community organizations we work with to train them how to enroll folks in SNAP. And they are called SNAP-Ps. And they do direct enrollment SNAP, as I think Liz mentioned, the Supplemental Nutrition Assistance Program, formerly known as food stamps. Colorado has pretty abysmal numbers in folks who are eligible but participate. So about 60% of the folks in our state that qualify for SNAP are enrolled in it. And WIC is similar. And part of that state shame and stigma, especially when you live in a small town, you may not want folks to know. You may feel like you're taking benefits away from others. That's what we hear from some folks. And so that's not the case. These are SNAP is an entitlement program. You qualify if you qualify. And so working with our SNAP-Ps and the community-based organizations who work with their own communities and have that trust really helps folks move forward from that shame and stigma or that fear they're taking away from others. And one of the programs that we work on that we advocate for at the legislature is called the SNAP Outreach Program. And that program basically helps organizations like ours do run our hotline, as well as the other organizations that help folks enroll in benefit programs. So, and actually that program, for every $1 Colorado puts into it, the SNAP Outreach Program, the federal government matches $1. So it's a really wise investment for the state. And so we're actually advocating right now that it's funded at 1.5 million. It's a $500,000 increase. So, the advocacy piece really connects with the programs piece. Sometimes we don't think of it as that, but it does. And the funding and making sure we're funding these programs is really vital to make sure that we do the outreach so that folks know about those benefit programs that Liz talked about, so that they understand them and that they're, and also we do a lot of advocacy. I think the next slide has that, maybe Ryan, if you want to go into the next slide. A lot of the advocacy that we can do as in this work is to improve these programs and to look at those barriers that are causing low enrollment when people qualify. I do think Liz's slides were awesome in that they showed the numbers are down in some of these benefits. And some of that is because with COVID relief, people got resources, right? And right now, folks who are enrolled in SNAP are getting COVID level benefits. And so they're actually getting quite a bit of help with groceries compared to normal benefits. And when those end, we're going to see that big cliff that Liz talked about. Even more so, you'll see the pandemic level help hitting that cliff. And so I'm pretty worried about, the pandemic has shown us really where our public benefit systems should be and the kind of investments we should have and the kind of benefits people should be getting. And so we need to keep fighting for those level of benefits in the future, as well as removing some of these barriers that cause folks not to enroll in SNAP and WIC. We work really closely with counties when we see issues happening from our hotline of folks calling in and not able to get SNAP benefits because a certain county is having a challenge or those pieces. We work with the counties to try and figure out what the issue is. And then we also work really closely with the state, that Department of Human Services, to look at the program and see how we can make it work the best way possible for clients. Right now, interviews are waived, which is really great. We should need an interview for every person applying for SNAP. We could use help in helping folks enroll in SNAP and make sure they're getting their documents all correctly and their income all correctly in, because it's complicated and sometimes people need that help, but we don't need interviews necessarily to make it even more complicated and scary for folks to apply. That's actually when folks apply for SNAP, the number one reason they don't, the number one point where they stop and don't continue the process is that interview. It really is a big barrier, and our Department of Human Services, as well as advocates like us and CCLP and others, know those interviews are a barrier and we want to stop them in the long run. So there's those kind of barriers that we work on with and are advocating to end. We also partner with food pantries. Go back, sorry. Food pantries are a lot of times the community-based organizations. They're the ones on the ground. So sometimes they're in the churches or the schools or the other places. We also have awesome food banks in Colorado that help, those are the big guys. There's 5 of them in Colorado. They regionally cover the state, and the food pantries often get food and purchase or get food for free from those food banks. But the food pantries also, know what their local communities need and need resources as well. So we created a Colorado Food Pantry Network where our food pantries work with us to advocate for resources, as well as let us know what they're seeing in the community, and really build up advocacy from community-based organizations. We are also constantly following and educating the state departments and our leaders on what is going on with food insecurity. So we do regular surveys. We also do a lot of community events where we bring folks in to tell us what's going on in these programs and what's going on generally. During the pandemic, we surveyed 4 times and we found food insecurity, which means lack of access to healthy foods to be able to in all foods, but healthy as well, to be able to live a healthy life. We found that 1/3 of the folks we surveyed during the pandemic said they were facing food insecurity. 40% of families with kids at home were saying they're facing food insecurity. Over 50% of people with disabilities were telling us they're facing food insecurity. And so those are astounding numbers. And we want to make sure that our leaders understand, like, just because we want people to really understand what food insecurity means. You may have access to the fast food down the street for $1, but do you have access to a healthy meal that is going to mean that you're healthy and thriving? So we do those surveys usually once or twice a year, but during the pandemic, we did it a lot more. And I think it really helped with showing our leaders they needed to do policies and invest funding in anti-hunger programs. And then we advocate to remove barriers to food for immigrant communities. During the Trump administration, it became a very scary time for a lot of immigrants, and I think it still is. And we're, always advocating to remove those fears, and that we shouldn't be using public benefits to scare folks. We should be making sure people have access to the food they need. So we've done a lot of education on rules around the public charge, which, what folks can get in benefits and not risk getting their citizenship. And the fear, we have kids who are in mixed status families who could be getting benefits, and we want to, help families understand that and get the benefits to the utmost, as well as supporting, other programs like Liz talked about that are really helping families and making sure that immigrant families are also able to get that access. Next slide. So our priorities this session, I do a lot of advocacy at the legislature, so I focus a little bit more on that. We have a bill for healthy school meals for all. During the pandemic, some of you may know school meals are free for all kids who need it. It's been life-changing. We've seen many, many more children, a third more children eating, getting free food and eating. And we just know that the benefits were there and kids needed the food. So we're advocating the legislature do something about it. The COVID School Meals for All ends June 30th. So we have a bill that would create a state program and match and bring in as many federal dollars as we can. We'll see what happens with it. It's a big bill and big goals, and it might be a couple years of base building to get there. We also have a bill that we're working on to continue funding for food pantries. As I was talking about, those surveys that showed the need and the work we do with food pantries as well as community, created this program before the pandemic, and it's really been used during the pandemic to get a lot of food with state dollars for pantries to be able to buy food and get it to their communities, healthy food like milk that's not about to go bad, eggs, vegetables, all of these things. And it's been a great resource, and we're advocating to continue funding it at a higher level because food costs are up 8%. You probably see that at your grocery store, and that makes it even harder for our community-based organizations to provide the services people need and the food people need when the costs are so high. So we're advocating for that, and then for things to improve the SNAP program, and then we really look at responding to hunger as a broad lens, and that we have to work and support other things going on to help families who are facing economic insecurity so that they can get food. That you have to be able to afford to live to be able to buy healthy food. So some of the other bills we're supporting are improvement to that temporary assistance for needy families, increasing that and removing barriers. There's a bill to create Medicaid access for immigrant mothers and children with the state paying for it where the feds won't. We would love to see that bill pass and support that. A lot of renters' rights bills we've supported. We need to protect renters' rights so that they can afford good food. And then agricultural workers' rights. There was a bill last year that's being implemented this year, and we need to make sure it's implemented and that the rules are fair and that agricultural workers are protected. So we do a lot of support of other issues as well that we know impact food and food security. Go ahead. Next slide. I just put some information on our Why School Meals for All. We need to stop stigmatizing lower income families and kids and adding to families' debts. We need less administrative burdens. And then as Liz was talking about that cliff, we have that cliff with school meals too. It's actually 180% of the federal poverty level is what families qualify for free meals at school. And what we've seen is those families that are beyond that really getting food. And we're going to put that cliff back in place if we don't have school meals for all continue. Next slide. We go to the next slide. I already chatted about that, I think. I don't want to take too much time, so we can go through, people can read it. I just wanted to give this information at the end here. You can sign up for our advocacy alerts so you can be part of advocating for these anti-hunger programs and making them better, as well as creating them like School Meals for All. Anya, my colleague, works really closely with Liz on SNAP issues and administrative stuff to fix SNAP and make SNAP better. You can email her with questions on the SNAP program. And then, I do more of our child nutrition and food pantry work. So you can email me on those questions on those. And then I also threw our Facebook page in there. So I think, share, I know we're gonna do questions at the end, but yeah, Sharon, I can throw an action alert on 1364. The food pantry bill is up tomorrow in appropriations. So, and I know there's discussions about cutting back how much it's funded at, and that would be with the need being so high and groceries being so expensive, I think that would be horrible. So we really want to try and get that 5 million. Right now, 150 pantries share that 5 million in 51 counties in Colorado. So I'll throw that action alert in there, but I'll hand it off to Jackie. I know it's time for Jackie.
Thank you so much, Ashley. That was really incredible and helpful. And once again, learned a ton about very specific things. And We're going to go to our final presenter, which is Jackie Aldape. So Jackie works as a Medicaid enrollment specialist at the Colorado Coalition for the Homeless. She has been working with underserved populations across Colorado since 2006 and has experience in Medicaid and other public assistance programs, as well as processing applications and determining eligibility at the state level. Jackie lives in Fort Collins with her daughter and has been with the Colorado Coalition for the Homeless for 2 years. We're really excited to have Jackie here to speak specifically to how the Colorado Coalition for the Homeless works to connect individuals experiencing homelessness or at risk of homelessness to these resources. So I'll hand it off to you, Jackie. Thanks.
Hi, everyone. So my job at CCH, I work at the South Street Health Center, and I do Medicaid enrollment. It's just a team of 2 people. It's me and Luz. We're really small. So yeah, so next slide, please. So how and where to access Medicaid. So the next slide will, I put in a map of where Colorado has locations within Denver area. We are a CAS site, so this link will show you any other place that anyone can go and apply for Medicaid. It's, there's a lot of other places and just not us. And since we are super small, we wouldn't be able to handle a large volume of people coming in. And then, yeah, so I just included that on there, the link. So at South Street, we are, like I said, a certified application assistance site. We are open to anyone to apply for Medicaid, and they don't have to be patients with South Street. So it can just be anyone, word of mouth. They can just come in and say that they need to talk to Medicaid and they need to apply for Medicaid benefits. Our process is they pretty much go at the front desk and check in, and then the front desk notifies us to see them, to get an application going. We also do offer appointments for clients who don't have the time to sit for like 10 minutes and do an application. And then we also do get calls from the exam rooms from the providers when the client is in there. And we pretty much just go up there with our application in hand and get signatures, get information. So we try to make it easy in case, they're in an appointment and they can't make it after their appointment. We try and go up there while they're, waiting to see the doctor. Next slide, please. And the client access enrollment rep, we do face-to-face applications. We do paper and also on Peak. Our job is to pretty much just obtain demographic information, verifications, and signatures so that we can go ahead and forward that to the county or to the liaison line, which is actually where we send most, like 99% of our applications to. So the liaison line is a quicker processing time frame. We've noticed when I first started, we were sending them to the county of residence, and that would take up to 45 days, if not more. But the liaison line seems to get them back within a week or 2, which we were like, oh, why not? It's faster, it's quicker, people get their benefits. Peak applications are not ideal for us just because our clients are homeless and they move around so much, and their eligibility through Peak can affect, since if they have Medicaid open in other states, Peak for some weird reason can pick up on that and won't approve a client if they have out-of-state benefits. So then the application gets transferred to the county and it takes longer, like 45 days plus. So we try and steer away from that and just send it to the liaison. We also do assist our clients with their redeterminations, and then we submit their verifications. So they'll come in with a letter from the county saying, hey, they're needing income, I need to send in my ID, or some whatever it is, then we help them send that out. And we usually just always send that to the liaison line. But like I said, the liaison line is our best friend, and when it comes to processing anything that has to do with Medicaid. Next slide. So we assist with all types of Medicaid programs. So as we all know, Medicaid does break down to different programs. There's your regular Medicaid, which is the Medicaid, and then we have CHP Plus. The Medicare Savings Program is for our clients who are in with Medicare, Part A, Part B. We help them apply for that savings program so they can help get their premiums paid and co-pays. A lot of people actually, don't know about it, a lot of our clients. So our job is pretty much to let them know, hey, are you paying for your Part B? Would you like to get your $170 back? And everyone's all for it, more money. And then the working adults with disabilities, we also help our clients with that. If they are working and they're not on Social Security, we do assist with that ARBOR application and send that out to the county for processing. That program specifically does have to go to the county because the ARBOR applications get mailed out in like Pennsylvania, and it takes about 90+ days for that application to go through. We also do emergency Medicaid this usually falls under our clients who are pregnant and are undocumented. We do help with that. We do have some that come in from hospitals that are referred, saying, if they were in a hospital due to a life or limb condition, they come in and want to apply for the emergency Medicaid. So we also do help with that one. And we do also offer other financial assistance for clients who get denied Medicaid, such as the CICP discount, which is the Colorado Indigent Care Program. But for that one, there's specific things that go with that. Next one. So Medicaid application follow-ups. Next one, like I said, we do follow-ups with the liaison line to obtain the status of an application, and they can let us know if the application was approved or denied, or if it's pending verifications, and they can let us know what type of verifications they're needing in order to finish processing. And then we relay the message pretty much to the clients and say, hey, it looks like they're needing you to close your benefits from Wyoming, or you need to provide income. So we just let them know, and then they bring it back and we do the whole faxing for them. Next slide. So we do also a lot of troubleshooting for circumstances for our clients, since they're limited on having access to internet, having phones, computers, things like that. So next slide. We assist our clients in correcting their demographical information with Medicaid. We do come across sometimes Medicaid has a different birthday than what we have in our system, so then we need to submit IDs, or we have to call the customer service line so that we can get their information updated. A lot of name changes. We also help with that at the customer service line. We help our clients switch their primary care physicians by calling the Health First Colorado. We also provide them with a printout, because outside of the Subsidized Health Center, we have someone that hands out phones for clients who are on Medicaid. And because a lot of our clients need phones, they come in and ask for a printout so they can go outside and get a free phone. We get them that paper, and then they go outside, they come back with the phone, and it's great. It's a free phone. We also help them in creating their PEAK accounts and accessing them. So a lot of them, since they don't have emails, we can help them create an email, have a PEAK account set up, and then, or if they lost a phone and they want to check in their PEAK account, we help them log in and say, okay, this is what they're needing, or submit changes on PEAK. We can help them do that. We also connect our clients with case managers to apply for other benefits, since our department is only, like, me and Luz only do Medicaid. The case managers help apply for like SNAP, old age pension. They help them apply with Social Security benefits, everything else that's not Medicaid. We also assist with, like I said, closing their status state benefits. We try and make the clients do this on their own a lot of the times. But if they come back and say, hey, Jackie, I couldn't get a phone. Can you help me? We'll go ahead and take the time, just because it is a long process to help them close out their benefits. You can be waiting an hour on the phone in another state just to close someone's benefits. So that's it's kind of time consuming. So we try and leave it up to the patient first before if I let them know, though, say, hey, if you can't, just come back. But about 90% of them can actually get this done, which is surprising. We help them request Medicaid cards. So a lot of them come in saying, hey, I need a new card. We'll go ahead and get that set up for them, call the state and say, hey, this person needs a new Medicaid card, verified addresses, and just let them know that it's on its way. Next slide. And we also are aware about the upcoming changes, which is the public health emergency ending. So far, we're just aware that the state will notify our clients 60 days prior to those ending. And then the requirements of the signatures. We're working on having our clients update their information just because everything's going to be sent in the mail or on peak. So anybody that's been coming in, we are letting them know saying, hey, you know, there's going to be some changes. We need to make sure that you're able to receive your mail. Or if you're picking it up at St. Francis, which is where a lot of them get their mail, we let them know and say, hey, we need you to make sure that you start checking your mail frequently so that it doesn't get returned. So it's, you know, this is kind of still a work in progress. We'll see how that goes, but we're working on it. And we definitely try and make our clients know that we're there to help them and we're not there to create any boundaries, because we all know that, you know, it's rough out there for them. And we want to make sure that where they come to South Street, it's their one-stop shop and they can get everything that they need when they're there. And then, yeah, that's my information. And Luz. So yeah, like I said, we're a really small team. So, you know, they're welcome to come in, call us, make an appointment, or just do like a walk-in, like I said, and we'll be there to help them apply for Medicaid or update any information that they need. Yep.
Great. Thank you so much, Jackie.
Yeah.
Yay. So I'm going to welcome back all of our speakers tonight. We have, you know, 10 to 15 minutes to answer questions. Because we're a little low on time, I want to make sure folks know that a couple questions were answered in the Q&A box already. So thank you, Liz, for answering those two questions. We had one about undocumented folks and nutrition-related benefits, and there's good links in there in the answers. And then also another question about if grandparents who are raising grandchildren can receive OAP and Tanf. So please check the Q&A box and respond to those. Check on those. So as we jump in with a few questions, one of the things that we were wondering about was how eligibility compares to enrollment levels. I know that it's not exactly something that can quite be documented, but maybe Liz in particular, or if anyone has ideas of sort of who's eligible that isn't already accessing these benefits.
That is the question that we ask ourselves quite often. A lot of programs that provide public benefits assistance in Colorado are not at capacity, meaning that there are quite a few people who are eligible who are not receiving benefits. As Ashley was sharing earlier, I mean, SNAP is one of those. As I discussed in my presentation, WIC's eligibility is at 50%, and it actually might be lower now. And Medicaid as well, even as that, and the enrollment rates are increasing, especially with the you know, in light of the pandemic, it's still not everybody who's eligible is enrolled. And it's definitely a question that we ask, right? Don't we ask ourselves this, like, why? What can we do about it and why? And I think that this is an ongoing question that we're striving to answer. And it's something that is incredibly complicated and something that we definitely will need individuals who with lived experience to kind of help us to figure out.
Yeah, and if you don't mind, Yanni, I think a lot of it's the barriers that are in place that make it complicated. You know, I've tried to apply for things sometimes and it's pretty complicated. It's not an easy process. So people like Jackie are very, very helpful to get people through it. And then, you know, our society is not very kind to folks in need, and there's shame and stigma out there. So we got a ways to go for sure.
Thank you. We have a question from Roger Frame. It says, what sources of support are available for people with substance abuse issues?
I was just pulling up some information about, and actually, Jackie, you might be able to answer this. I know that the behavioral health benefits through Medicaid or Health First Colorado is something that is becoming more robust, especially as advocates really push for behavioral health services to be connected to primary care services. But you might know more about that than me. I'm doing just I'm trying to find some links, and I'll include those in the chat.
Yeah, so Medicaid does have mental health coverage. It covers a whole bunch. So once you're approved for Medicaid, it's like a big branch. You're automatically approved also for dental through DentaQuest. You'll have behavioral health. You have prescription coverage, and it's pretty much just finding a provider that accepts Medicaid. At South Street, we do have behavioral health, and they're the ones who handle pretty much just, go through the appointment, do the evaluations. And if the client needs to go somewhere else, be referred somewhere else, then behavioral health kind of takes care of that along with the provider. So they kind of work hand in hand on getting the clients the support and the tools that they need in order to get the help they need. I think we also work closely with, like, if they need rehab, Fort Lyons is another place that they get referred to. So there are ways. They just would have to make an appointment with the provider, talk to them, and then go through the process of behavioral health. But Medicaid definitely does cover for that. They just have to be within the Medicaid network, I guess.
Thank you. One question my colleague Aubrey and I were talking about was, we went to a webinar recently about dental care, and one of the questions that came up in that was, could SNAP ever cover oral health supplies such as toothpaste, or generally does SNAP cover any non-food essential items?
No, there's been discussion. It doesn't even cover hot meals. So freaking irritating. Sorry. Like, people should be able to go to the grocery store and buy rotisserie chicken, but whatever. And then another thing that there's been a lot of advocacy around is diapers. So yeah, I think there needs to be more conversations on that. Then the closest thing I think to happening is going to be hot meals, though. Maybe there's going to be a bill called the Farm Bill. It's like a big bill they do in Congress. And SNAP just happens to be part of that agricultural programs, which is kind of helpful, gets it passed. But I think the hot food stuff might come up in that. So at least maybe people can get hot food at the grocery store.
Thank you. So a lot of, I think almost everyone spoke about some of the upcoming bills or current bills that are happening right now. We only have a few weeks left in this session. So if I know that for us at the Colorado Coalition for the Homeless, you can sign up to be part of our advocacy network, and you'll get alerts on how to reach out to your representatives. And so for that, you visit coloradocoalition.org/advocate. I wanted to give our other speakers the chance to talk about sort of anything you missed in terms of what you're working on this session, and how folks can get involved who are on this and want to maybe, impact some change with their representatives.
Ashley has all the.
I was going to say Liz might have more than I have. I've talked about mine, but Liz, you might have.
We have a ton of bills that we're supporting. We have quite a few bills that we're pushing and leading on this session. I'm just looking up the link, and I will put it in the chat to our website that has a list of all of our bills.
Yeah, Aubrey does great work on your behalf at the Capitol on the housing stuff. We support most of I think everything you all do. But I do think my advice to folks is to follow the organizations that you're passionate about, so that you keep your eye on what those topics are. So CCLP does a lot, Hunger Free does a lot, so does the Colorado Consumer Health Initiative. But that's not even accessible, right? And that's something we're trying to work on in our policy work, is is driving it from community rather than driving it from grass tops, because it's not accessible. So we've got a ways to go on that.
Completely agree. We are definitely doing what we can to include more regularly, actually just kind of in the fiber of the legislative work that we do, people with lived experience. And so that's something that we'll be pushing and trying to develop this next summer. I'm not sure if everybody on the call is familiar with CCLP, but we are an anti-poverty organization, and we focus on 4 different focus areas. That's food, income, housing, and health. And so all of our bills will be kind of tailored to those particular focus areas. And I included a link to our legislative priorities in the chat. So happy to join you all this evening. Thank you.
Well, thank you all so much. That was incredibly informative, and I'm really excited that we got to share it with everyone and that we get to put it online so that more folks can check in. Ryan, if you could just share our last slide or two, I'll take us out. So once again, just want to mention our websites. You can come visit us if you want to learn anything. Looks like our handle got cut off. That's okay. It's at CO Coalition. And then just letting everyone know about our next session. If you go to the next slide, Ryan, which is on climate change and homelessness, intersecting crises. And we have that happening on May 19th. We generally will have these sessions on the 3rd Thursday of most months for the rest of the year. And so we really hope you can join us. Thank you so much for attending, and we really appreciate it, and we'll hopefully see you next month.